Hi, my name is Kathleen Austin. I'm a graduate student at the University of Texas at Arlington College of Nursing. I am in the Management of Nursing Operations class. This will be a comprehensive strategic marketing plan for Post-Acute Medical Hospital of Texarkana, Texas. Post-Acute Medical Hospital of Texarkana, or PAM for short, is on the campus of Christus St. Michael Hospital. There are actually 3 different hospitals on the same campus. First, there is the Acute Care Hospital, St. Michael. Then there is the St. Michael Rehab Hospital. And then we are the Post-Acute Hospital, which is located on the 2nd floor of the rehab. Post-Acute is not affiliated with the other 2. Post-Acute has been at this location since 2014. They are accredited by the Joint Commissions, which their accreditation symbolizes an organization's commitment to meeting identified performance standards. Services include, but are not limited to, rehab, aggressive wound care, long-term antibiotics, ventilator weaning, aggressive pulmonary toileting, dialysis, and much more. PAM takes an individual approach to ensure each patient's needs and goals are met. Our nurses work 12-hour shifts. A nurse's normal assignment is 1 nurse to 6 patients. There is also a high observation unit, which those patients are considered intensive care or critical care. The nurse ratio for that is 1 nurse to 3 patients, and only RNs take those patients. We employ RNs and LVNs. There's usually 2 CNAs that split the floor. The capacity is 30 beds. 2 of the beds are in a negative pressure area, which those are private rooms. The rest of the 28 are semi-private. PAM takes a team approach, and the patient is at the center. PAM is a small hospital that gets their patients by referral only. There are only 3 doctors that admit patients to the hospital. There's a nephrologist, a pulmonologist, and an emergency room physician. The overall goal of the hospital is to increase patient census over the next 3 years. In order to increase the census, there's going to be a need for new referrals. There are clinical nurse navigators that go out into the community. They go to the hospitals, the nursing homes, doctors' offices to see if PAM can be assistance to any of their patients. PAM is attempting to recruit more physicians through Area Health Education Center, which is AHEC for short. Having 2 or 3 extra doctors willing to help with call and new admissions would be tremendous help. PAM has an interdisciplinary team, which is called IDT, that keeps the patients and the family members updated once a week during walking IDT rounds. The hospital takes a team approach to getting the patients back in their own homes. This team consists of physicians, therapy, respiratory, nursing, case management, dietitian, pharmacist, and speech therapist. As the patient's acuity increases and length of stay decreases, improved effectiveness and efficiency of the interdisciplinary collaboration, communications, and care planning become bedrock to high-quality care. PAM is committed to providing high-quality patient care and outstanding customer service, coupled with the loyalty and dedication and highly trained staff to be the most trusted source for post-acute services in every community it serves. Being able to expand the capacity of PAM would be beneficial to the patient, the community, and the hospital. The strengths of PAM are the increase in census would include increased revenue for the hospital, increased jobs for the area. Weaknesses would include keeping enough staff to care for an increased number of patients. Through the pandemic, many nurses decided to travel. While a few came back, there are still many places for nurses to sign up and collect large paychecks. Opportunities of increasing census would be more jobs in the area, not just nursing, but ancillary staff as well. Growth of census could also mean expansion of the hospital. Threats. There is one other nearby. Although they do not take ventilators, they do take complex patients. They're more of a rehab, but that's still a threat. Post-acute offers dialysis at the bedside. This is not a contracted services. There are dedicated nurses certified to performing dialysis. There is a nephrologist that admits to PAM. PAM takes ventilator and high-flow oxygen patients. They gradually wean them off the ventilator and off the oxygen altogether if possible. The wound care at PAM is led by a physician trained in wound management, a nurse practitioner also trained in wound management, RN certified in wound care, and an LVN. The success rate of healing wounds is very high. There is also an infectious disease physician that makes rounds and helps with different types of infections. Post-acute medical hospital is an asset to the medical community and would be even more beneficial if it were able to increase the census of the hospital. This would offer more opportunities for patients to be able to remain in the area without going 3 to 4 hours away. Many patients during the COVID pandemic came from many different states due to the lack of beds. Many of the patients are elderly and have a spouse that would not be able to travel daily to see them if they were out of town. This would also increase job opportunities in the area, not just nursing, but ancillary as well. This would also free up hospital beds in the acute setting. Thank you for listening to this proposal.